just the normal things that I finished doing, and I asked her, please, please, what is my blood pressure?
55%.
Over 80 or 120 over 60. You tell the patient, it understand this because you are my own. What you see UK through MJB management is actually my own. You can reach out to me at any time you have a challenge. That is the way I see everybody that passes through us for one thing or the other. So it is important for us to know, because you know why I'm saying so. I had once gone to a hospital. I wasn't feeling too well, and my blood pressure down, and I went to the hospital. So when I got to the hospital, I met the desk nurse. The desk nurses, that's the certified nurse assistant, told me to sit down. One of them, I sat down, took my blood pressure, and low, and actually, I think 70 over 50 as at that time, because sometimes it gets like that with me. My blood pressure can just go down, so I just try to regulate from time to time. So I went there, and my blood pressure was actually low, because what's my about 60, I think so, or whether it was even 70 over 50 as at that time, I cannot remember exactly. But what I know is it was low as at that time. So she told me that, your blood pressure is low, madam. What was the problem? Your blood pressure is actually low. 80 over 60 is not very right. What I want to advise you to do is to take a sugar, like to take maybe Coke or something that will help you to boost your blood pressure to make it high. So the mistake was that as she was saying that, the doctor was just arriving. The doctor that was in charge was just arriving, was just into the ward at that time. So he heard the nurse telling me, oh, your blood pressure is low. That certified nurse assistant was telling me, oh, your blood pressure is low, because I have a way with people. Like I have a way. I was actually telling her, please, can you just tell me? I'm a bit worried. And this, I was trying to cue her, and heard her telling me that my blood pressure was low, that it's not normal. So she's advising me to take some things, to take a Coke and to take this. I tell you the truth. I just say, let me share it with you. I tell you the truth. It almost cost her job. I mean, instantly. Why? Because it's unethical for you to do that. As a certified nurse assistant, you cannot at any point talk about a client's health condition, something that should be done by a doctor. Because after the science is, okay, this is actually going to be, and this is actually going to be, because it falls within their jurisdiction. But as a certified nurse assistant, you cannot, let me call it, maybe diagnose, and then you give solution. Let me use a layman's language. You give solution to say, okay, this is what you're supposed to do, and this is what you are supposed to do. On ethics. Were you supposed to tell, how do you know that her is low? That was the question. I will never forget that thing. And I was even worried because I was almost making someone lose her job out of my inquisitiveness. So I just remember to bring that to this plan, tell you that it's more than anything. It is important, especially if you are a CNA that want to go and work overseas. In Nigeria, some of these things we just let go. Anything goes in our country, Nigeria, dear country. But when you have to go out, you cross the shores of Nigeria, things are very, very, there are stringent measures, and you adhere strictly to the principles. Any little thing can cost you your job. So I just thought I should share this. So blood pressure, we have two types. We have the systolic is to here, like I said, the lady told me 70 over 50, or and all that. So I like to do, I know we have a couple of people as professionals here that maybe at this point, so that I can just drink a little water? I don't know. Is there anyone that would want to, maybe from experience, would want to say just tell us one or two things, whatever you know about blood pressure, checking whatever you know about the numbers and the diastolic and the systolic blood pressure. Who is there anybody that would like to build the cards? You know, I don't like to talk too much, and so far I've just been talking and talking. So please, do we have anybody? Or continue thinking? Hello, are we still together?
Yes, we are together. We are listening.
Together. We are together.
Yes, go ahead, Alicia.
Yes, ma'am. Please continue.
Just go ahead.
Okay.
Just go ahead.
We are enjoying it.
Okay, so
Enjoying the
thank you.
class. Yeah.
So let's continue, since I thought maybe we could have one or two people share something concerning.
Yeah.
All right. So we have this.
Before you continue, I would like to ask.
Okay, please do. You see, I love people to add. I don't know whether you say you want to contribute or I don't know. Go ahead. I'm trying to hear you.
I want to ask a question. This is Isaac from Liberia.
Okay, Isaac, go ahead.
Yes, you just shared a past experience, and from that I want to ask a little question. You said the CNA checked your blood pressure, and it was a kind of low one, and you are, because you were eager to know what was actually happening to you. And she told you exactly what she saw on the machine.
Good.
But the aspect of, I don't know whether she or he, telling you that it's not good for you, you have to take so and so many. For that aspect, I understand that is wrong. It's not. But for the one that she told you that this is the status of your blood pressure, was she wrong to do that?
Okay, thank you so much, Mr. Isaac. I want to say this. I want to say this, that for us to function, you know, we've paid, considering considering the economy, we've had to squeeze money to pay because we want to have value and we want to actually be perfect in the health field that we have gone to. I want you to understand something, like I like to say, a CNA does not have the right to divulge any information that is health related to a client, to a patient. If the CNA is your sister or maybe is your brother, fine, it is ideal, or will I say ideal or advisable? Maybe you just ask, my brother, please, what's that, my BP? What is it and what is that, outside the formal setting? But in the formal setting, what the CNA was supposed to do was to check your temperature, to check your, maybe, in this case, your blood pressure, and then document it. She is not supposed to, those nurses you see, it's unethical. That's the right thing. She's not supposed to tell you that your blood pressure is this. You are supposed to proceed to the next line of care. You're supposed to proceed to, like when she's done with you, she submits your file, and then it is where you get to the doctor that you are actually going to see. Is the doctor that will say, okay, reading from your vital sciences or from your whatever, well, your blood pressure is not too good, it's low, and as such, we have to recommend this and that and that. That is the next line of care. The certified nurse assistant is not supposed to tell you that. It happens. So I must tell you, it happens. So in hospitals, I've seen it, it happens, and it's just a walkthrough, but we want to get it right. We don't want to get it twisted. It is very important that you know these things. The job a CNA does is not to do any direct reporting of any health, For instance, maybe if that person is very vulnerable, maybe you've seen that, oh, you've checked the pulse, yes, because you're in the medical field, you know that, this person they are bringing, oh, God forbid, this person will soon go, this person cannot even, it is wrong for you to say that. I want to give you another illustration, like I like to say. Okay. I like to tell a lot of stories so that you will understand, because we are going to be dealing with human beings. So when when we are dealing with human beings, we need to understand the ethics. The Isaac, thank you for that question. So it has made me to remember something. I have a lot of experience. It made me to remember something that my mother always told me, that when she was actually pregnant for me as her first child, that the nurse, that one was even a nurse, not even a certified nurse, I think, a nurse, if I understood what my mother was saying, that I was lying in a transverse position. Those of us transverse, that's not in the proper way baby comes out. I was lying in another direction. That was not. So she didn't know, because it was in a Yoruba place, a Yoruba state. So she didn't understand. She could just pick pieces and pieces of what the nurse was saying. The nurses, they were there was a conversation, they were talking. And they were saying, this woman's baby is transverse, it's lying transverse. They were saying that it's lying transverse. So my mother kept hearing transverse, and she understood what transverse means. So as soon as the doctor came, she when you tell a patient such, there's already some form of agitation, especially a woman that wants to give birth. There's some form of agitation. She becomes unstable on a very normal setting. Yeah. So when the doctor came there, my mother said, I will never forget that. She always used to tell me, and we laugh about it. She said, and when the doctor came, she now told the doctor, doctor, please, I'm sorry to disturb you. Please, doctor, I am feeling that my baby is lying transverse, because I am told that the baby is not lying well. Doctor, I wouldn't want to have a cesarean section. So when she said so, the doctor flared up immediately, because when she said that, she heard and they were saying that the baby was lying transverse. So the doctor now said, Madam, who told you that your baby was lying transverse? You understand? So that brought another situation entirely, because the nurses talked in their own way. They did not consider the fact that this person. So it gave her agitation, and the doctor was not happy. In fact, he called the nurses to order. It was thank God that it wasn't so serious, but he had to call them to order and warn them never to repeat itself again. So what am I saying? Especially a certified nurse. For a nurse, you even have more, you have a higher, you have more responsibilities and the extent to doing most of these things. But a certified nurse, imagine if it was a certified nurse that told my mother that, they wonder, how do you know that this, and even what rights are you supposed to even tell the patient that this person is transverse? So these are some unethical things that come into play. Maybe we just do it without really following the processes. So that's practically it, Mr. Isaac. I think there's a Zelmi raised hand. I don't know the person right here.
Hello, good evening.
Good evening.
Hello, good evening. Okay.
Good evening. The raised hand. Okay, yes, Martha. Yes. Martha, please.
Yeah, my name is Martha.
Okay, Martha.
Hello.
Yes, Martha, I can hear you, Martha. Go ahead.
Okay, so I just want to support what you just said as regards telling a patient about their vitals. Yeah, it happened to me. There was a time I went to the hospital, and then on getting there, the nurse checked my BP, and then the next thing she said, she checked it first, and then she looked at me, checked it again, looked at me, and then said to me, are you sure you're okay? Can you calm down? Just calm down. I want to check it again. And then I was becoming a bit worried, and I asked her, I said, what's it? And she told me, she just asked, have you not been sleeping? Is anything bothering you? You know, she was acting like a doctor. But then I was worried. I was very worried. And then the next thing, she checked it again and said, calm down, just calm down. Maybe you just walked in and all that. And so because she told me that my BP was high, I became worried. And I mean worried, I was very worried, you know. When she checked it the third time, it was even more than what she saw before.
Wow.
So on getting to the doctor's place, and as that then I was already a bit, when you're worried and all that.
Yeah.
And the doctor, I just entered and I asked the doctor, I said, am I fine? What was the problem? because of the way the nurse attended to me and the way she was not professional about it. She was so blunt. She just told me your BP is high. Why? Are you sure you're fine? You know? So out of that, I was very worried. But on getting to the doctor and I reacted, the doctor just looked at me and said, calm down, and asked me, how did you know that your BP is high? And I said, I just explained to her. I explained to her, I told her that, look, first of all, the doctor, she checked it first. She looked at me, she checked it the second time and said, look, calm down. Are you sure? You know, she was just sounding so funny. Do you understand? And at the end of the day, when the doctor told me to calm down and explained to me that BP can, you know, the rise of BP can come in different ways. He asked me a question. He said, what's the nature of your job? I told him. He said, have you been sleeping well? I said, well, for the past 2 or 3 days, I've not really slept because of my job and all that. He had to educate me. And then told me the reason why my BP went high and told me, okay, just sleep for 2 days. After 2 days, just calm down, sleep. And then when you're okay, check your BP. That was even the reason why I had to buy a BP machine in my house. And then he just told me, check it again after 2 days, but make sure you sleep well. And immediately 2 days after I had a very good sleep, I checked it and everything was normal. And then since then I've been checking my BP. But what I'm trying to say is that the woman didn't let me know. She didn't even make me understand what the problem is. I just felt, oh, there's a health challenge. There's something really bad going on, you know, in my life, in my health. So sometimes if they can resort to something else, and we need a professional to actually talk to these vitals.
Wow. Thank you. Thank you so much, Martha. Thank you. Even though they said even though it's a blessing in disguise, because you have just told us that because of that, you had to get a blood machine in your house. So you see, it's a blessing in disguise in a way. So what I'm actually saying is like interactive than it was yesterday because of maybe network assistance. We have to be careful. Because why? Because we are not directly involved in the health. We wouldn't know how best to express it to the patient. So, and it doesn't fall within our own job description to be able to actually know what to do because we are not trained to be able to do that aspect of it. So these are some of the things that we need to know as we progress. Please, like I said, you can drop any information or anything you want on the chat box intermittently. I am checking it and then we go. So let's move. Like I told you today, we can do a lot of talking because we don't have too much. Most of our duties, work today is for the practicals. So why do we need to check blood pressure? It's important. Is considered the most important number, like the systolic is considered the most important number. And because what does the systolic do? Because it's the upper number, is the top number, and it indicates how much pressure the heart has to work against when pumping blood. That's very important. The diastolic blood pressure too reflects the lowest blood pressure in the artery. So when we have the practicals, we'll look at one-on-one and see about it. So both these systolic and diastolic readings are used together to provide a comprehensive assessment of a person's overall blood pressure. So the two work hand in hand, the up and then the down. I can see that that Patience Gold, her hand is raised. Patience.
Yes,
Patience.
thank you.
Okay. Please go ahead. And,
I just wanted to maybe contribute and also seek a bit of scenario situation. So most of I used to have like the BP checker, the blood pressure checker at home, but mine got spoiled after a while. And due to constant use, I also spoiled my mommy's one. So
right.
know, okay,
so buy it for mommy.
If it's reading like this, it is high. Not that it's a detailed, but at least you know that if it's exceeding 120, if you have your historical, maybe from 130 above is going a bit above normal. I mean, if you even go online sometimes it will tell you, some chat will even tell you it's even mild hypertension, and they could tell you it's airstream. So sometimes when I go to the hospital, maybe I took a child to the hospital and I've not checked my BP for a while. I will just use that opportunity to, after checking the child's vital, to say, please, can I check my BP? I don't want to see a practitioner, I don't want to see a GP, but I'm asking the CNA there that can I check my blood pressure? And of course, I'm going to ask, what is it reading? So in that kind of scenario, is it right for a CNA to just at least give you, your reading? You already have a knowledge of what, to some extent you are able to interpret, and it's not like you are even seeing a GP. Will it be a violation of anything to, give that person? And again, I know that when you go abroad, things are pretty much, now I'm bringing in some level of culture, and I know what the standard. I understand completely what the standards are, but I will consider it very rude. If I asked, and I think somewhere in my growing up, it would have happened where I will ask you, what's my BP saying? And you're saying, I'm not in position to give you that. And I'm offended. It's culture thing. As in just BP. I just want to know, is that I'm not in position, I'm not, and it becomes something else, that kind of a thing. So in that kind of situation, what would the CNA be expected, to do?
Okay. Now, first and foremost, you see, this our CNA course encompasses so many things. It's very broad. Manner of approach. I still get back to manner of approach. I tell you, patients, I think, am I speaking with patients? Hello, patients. Am I speaking with patients?
Yes, please.
So patients, even as you will consider it rude, you can also tell me, to a large extent, if someone talks to you in a respectful and understanding manner, you would not feel bad. I can tell you that, even though I don't know you, but I can tell you that manner of approach matters. Now, for a CNA to tell you that, even if you're an outpatient, maybe you just brought your child and then you just want to check, like I said, anything happens here. It has happened. I've gone to hospital, I've mounted on the, please, can I just check my weight? It's like I've added some weight, let me just check. And the nurse will just say, you have the scale there, you can check, it happens. But we are talking about things that are ethical. Like now, we are not just talking about we are talking about things that are ethical, things that are within your professional level to do. So even in that situation, it is not the duty of a certified nurse assistant to give you your information, even if you know it, even if you know that your BP is already, you just want to confirm. It does not fall under the duty of a CNA to actually do that. And it depends on how the CNA will say, because of course, nurses and CNAs, just as we are different, we have our different characteristics and our different behavior. They're the ones that will talk to you, oh, please, oh, I'm so sorry, I cannot do or the hospital does not permit me to do that, or this or that, or, talk to you in a very respectful manner. I don't know, no, it won't, because it's going to fall against her ethics. It's going to fall against her ethics. But that's not to say it cannot be done behind the scene. As we do our normal day, please, can you just help me? Let me check this. How many is it? Just tell me and all that. That one is behind the scene. But for the ethical aspect of your profession as a certified nurse assistant, you are not expected to divulge such information, especially if it is adverse. What I mean by adverse is, especially if it is maybe for someone that has a high blood pressure or has a particular condition, you are not in the position to let that person know, no matter what. It doesn't fall under your jurisdiction. Rather, let the person proceed to the doctor or to the nurse. Those ones will be able to, because they have it's within their jurisdiction. They have their own terminologies. They have their own way of assuring the patient and letting them know, because that's their direct duty. That particular duty doesn't fall under a CNA's jurisdiction or job description. So I think that's fine for with you. I don't know. Can we move ahead?
Hello, can I say something on this BP issue? Sorry.
Okay, you are free to say. You are free to say. Go ahead. Today we don't have too much, so we can talk. Go ahead.
I'm Martha Awodi.
Okay, Martha. Okay, yes. Go ahead. I had another Martha talk. Were you the same Martha that talked earlier on?
No.
Okay, because I have about 3 Marthas in this platform. Go ahead, Martha.
Please, I want to talk more about the BP issues because the nurses and CNA, most of them are not professionals to handle that issue.
Correct.
Maybe if you have, for instance, in our pharmacy here, most people normally come to take their BP. When they take their BP, they check their BP. It's not in my position to tell them what their BP is. I will only
correct.
I will try the written notes to my husband, who is a qualified pharmacist. It was when last doctor, do you have BP drugs? You asking them questions. Ask them, okay, now when last did you when last did you treat malaria? Do you sleep last night? Are you feeling headache? When they start asking or replying to him, he will tell them now, okay, some of them will even go to the extent, please give me BP drugs, which we don't do. He will tell them no and if it is 130, I believe from age 40, 45, 50, 130 BP is normal. 150, 160, you have to see a medical doctor. So please, let's handle the BP because we are not professionals. We are not supposed to tell them that your BP is high, your BP
is low. Correct. Thank you so much, Martha. Thank you for that contribution. Thank you. I really appreciate that. It has just buttressed what I have said. So no matter the situation, we should understand that no matter the situation, we should understand that we are not in the right positions to actually tell these people these things. We are still having hands. Can we move ahead? Okay, Hope. Okay, let me take you as the last question because we still have some other things to move, at least the last module within the 1 hour remaining. Go ahead, Hope, please.
All right, ma. My own is not question, it's just a contribution. When it comes, I want to support the motion that is not advisable for someone to tell the patient the finding of the result if you are not in that position. Not even only in BP, not even only in blood pressure and other things.
Vital signs.
Not even only in vital signs. There are other things too. Once the current are supposed to do that. For example, now, because the reason why we do this is everybody have different level of anxiety. There are people, they have this high anxiety that you just mentioned something and only that particular one can lead to another illness. Yes, it can lead to another illness. So in that case, whatever you find out, refer it to the right person that will explain it because they have the terminology, the voice, the way they will summarize it and the person will understand it. Than you just blowing the something and it can cause a lot of other people. Experienced it. I've experienced it when a social worker did not do his duty, just went straight and tell the patient that you have this and that. That caused a lot of other problems and which even lead to another diagnosis. So whatever we do, they just know our boundary. There's always a boundary for every position. So that is my contribution. Thank you.
Thank you, Martha. That's beautiful. So you see, I'm so glad that we are all on the same page. I'm so glad. So these are some of, I'm so glad that we understand this because this is a very, very important aspect of CNA. This is in fact, let me say number 1 before we go to how to treat patients, maybe the practical aspect of it. So thank you so much. So these are some vital signs equipment. We have the thermometer, we have the stethoscope, we have the blood pressure cuffs, the pulse oximeters, things we have to take care of them because it's advisable that we keep them safe, that we take care of them. You keep them away from children pressing and playing with them anyhow so that they don't alter the figures you eventually have at the day. So what are some of the things we should do? Prepare the environment, ensure privacy and safety to see. So summary, it's very important because a vital sciences tells you the state of a person at any time, whether you are getting better or not getting better. So that having said, let's quickly, this is a very short module. We won't waste too much time because these are things that we already know and we are going to be seeing it. Now, these are activities of daily living. As a certified nurse assistant, you are expected to carry out some activities of daily living for your patients, for your client, like maybe bed mobility, you know, transfer gate, we are going to see some toilet, eating, bathing, this AD activity now, showering, what you always throws up and is disgusting. I cannot attend to her. No, because you have to have humanity in view. You know that she did not willingly want to throw up. It's because of having the issue that she's throwing up. So if you understand that, you learn to, you respect her in the midst of that, understand and respect her as a human being from what she's actually facing. So also, toileting to manage people problem as you escapes, you know, most times because of health challenges that they have. At no point should you feel, oh, this person has messed the bed, oh, you just feel bad, or you begin to maltreat or ill-treat the patient because you need to do a whole lot of things that you are not supposed to do, like maybe to keep changing the beddings and all that. You don't bring temper into nursing thing. When you are dealing with people that are vulnerable, you are having humanity in view. You don't bring temper into it. You don't bring your feelings, your feelings, in extreme feelings into it, your agitations or your aggressions into. You know, tell people are a certified tell yourself today is going to be a good day. Just speak something. Even when the vibes are not actually. So as I was saying, now we fluctuated network again. Network, please. So we are begging you to be patient with us. Okay, hearing me, please.
Yeah.
Like our ability on them that the proper techniques and assistive devices in hospital we have a do. Now to be like talk